continued distance learning if they wanted to, but we knew that we needed to get kids back in the classroom. And the evidence was abundantly clear then, and it's obviously even more clear now, that schools are not drivers of spreading coronavirus, and schools need to be open. It is a bad public health policy to have schools closed. And so today, all 67 counties in Florida are open for in-person instruction, including Miami-Dade County and Broward County. We have more than 60% of students in Florida, 1.8 million, are receiving in-person instruction. And if you talk to superintendents, talk to Richard, we have a lot of parents who want to get their kids in person. Now, some districts made them make a choice, and you had to stick with that for a little bit, but we're not seeing very many parents say, I don't want them in person, I want them to go virtual. Once they're in and the schools are operating, most of the parents are looking at, okay, how do I now get my kid in person? So, but we have to face the facts. There was gaps in learning that were that built up over March, April, May, and June. Of course, over the summer, although we did work to get summer instruction available for many students. But having the kids back in now in many parts of the state, you're talking about 2 months that the kids have been back in, and I think that that's something that we can look. And now, pretty much everyone acknowledges that having schools is open is the right thing to do. You've had all these different media publications that have looked at it, and they wanted to say schools are bad. I mean, that was more of their orientation. But it doesn't matter if it's in Asia, Europe, United States, all across the Sun Belt, all across other parts of our country, we've seen that having in-person instruction is vital, and it's something that needs to continue. We're also happy that fall sports resumed here in the state of Florida in all 67 counties. That would not have happened without the state's backing. In fact, there were many people saying that this was going to be a big problem. Actually, it would have been a big problem to deny all our student athletes the ability to compete. I've been able to attend a football game and a girls volleyball game, and Casey and I look forward to getting out to some other events as we go. But I think what you've seen here at the Classical Academy is really a great example of leadership. I mean, the teachers here were chomping at the bit to get back into the classroom because they understood their students needed them. And you have the percentage of students here on free or reduced lunches. What is it? It's pretty high, right?
It is. It's over 50%.
Over 50% free and reduced lunch. And so we had a situation where a lot of the affluent families, they could hire tutors, they could do pods, and God bless them for doing that. I don't begrudge anyone for doing that. But a lot of our low and middle income families, they didn't have that option. And so they needed to be able to have their kids in school. And so I think that a lot of our charters really led the way, a lot of the private schools, because they did not have to deal with political opposition from the union. And the union filed lawsuits. They've gotten totally dismissed out of hand those bogus claims. But their goal was to keep kids out of school, and they were wrong. And we can say that the charters and the privates did a great job, and so many superintendents throughout the state of Florida worked very, very hard because they had to deal with a lot of this political movement, but they put their kids first. And so I'd say up and down the state, we have some of the best superintendents in the country. So I'm really, really glad to be able to be here. You're going to hear from some of the teachers. You'll hear from Richard a little bit more about some of the things that are going on. But I think we can say this. Going forward, whatever the future may hold, school closures should be off the table. They don't do anything to mitigate COVID, but they do cause catastrophic damage to the physical, mental, and social well-being of our youth. Let's not repeat any mistakes of the past. I also look at some of the other things that we're doing in terms of COVID, and again, keeping this idea of health being not simply the absence of disease, but also physical, mental, and social well-being. We've applied that in terms of supporting our at-risk population. And we've done a lot of mitigations to support particularly our elderly population, not just in nursing homes, but beyond. But I think that this principle was really shown to be very, very important in terms of what's happened with long-term care visitation. when the pandemic was really getting underway in March, we and many other states limited visitation because they didn't want the disease getting in. It's obviously very deadly when you're talking about elderly folks with a lot of significant underlying health conditions. And I think it did prevent the disease from getting in, but it also came at a cost because you were separating people from their families. We'd send in iPads, there would be different types of window visits, but that's just not the same. And so it was pretty clear to us as the summer wore on that this was really causing a lot of loneliness, despair, and that we needed to get these families reunited. And so we convened a task force, including with a great lady from here in Northeast Florida, Mary Daniel, and we had a plan to get the visitation open again. And here is an interesting thing. When we did the visitation, we looked at it and said, you know, we may end up having more outbreaks as a result of it. We think we can mitigate it because we have PPE, testing, all this other stuff, but we just have to accept that that may be something that there's a possibility of happening. But I think most of the folks in those facilities were willing to take the risk in order to have that family and friend connection. Interestingly, since September 1st, positive tests for residents of long-term care facilities have declined by more than 70% in the state of Florida. Now, part of that is, we had more prevalence in July than we've had in September or October. But I think part of it is when you have the family members in there who really care for those folks, I think it causes the staff to perform better. I think everyone is a little bit more careful. And so I think it's something that has really tended to help physical, mental, social well-being of our elderly residents. But I think it's also helped mitigate the disease even more. So we're glad that we were able to do that. We're also continuing to look for different ways to protect the most vulnerable here in the state of Florida. And I've done announcements on this, but we've distributed hundreds of thousands of the new 15-minute rapid test. It's Abbott Labs Binex Now. This is a test that all you need to do, you put the reagent in, you do the swabs, put it in, close it, and you get the result in usually less than 15 minutes. So this has been sent, the HHS is sending hundreds of thousands directly to skilled nursing facilities, and then the state of Florida is taking our allotment, some of our allotment, sending it to all long-term care facilities. They'll be able to do spot testing of the staff or even routine testing of the staff. And they also can use it to help with visitation. Now, we didn't require them to do that because when we were doing this in August, we didn't necessarily have unlimited rapid testing capability. We had some machines that were being delivered in skilled nursing facilities, but we didn't want to get in a situation and say, okay, go get a PCR test on Monday, and then you'll get the results back 3 days later, and then you can go into the facility. Well, who knows whether you got infected in those 3 days. So we decided, let's just focus on mitigation. But now that you have the 15-minute test, if the facilities want to do that, if family comes, they want to do it to be safe, they can do that as well. So it's a good tool for these facilities, but we're not limiting it to those facilities. We have asked any senior community, so not just folks that need assisted living. These are communities like the Villages, Sun City Center, Century Village down in South Florida. If you want it, we're going to send all these tests. So it's the same concept. If they want to use the test to be able to facilitate more family visitation, maybe they want to do it if they're going to have different types of events, they're going to be able to do that. And so anyone that is interested in that, we do have an email rapid test for seniors at em.myflorida.com, and you can request it, and we will send those to the community. But these are very easy to administer, and you get a good result. They're not 100% accurate, but they're pretty close, and we think that it's a good thing. The other thing we're looking to do, particularly for our most vulnerable residents, is get these therapeutics out as soon as they're ready. So what's happened is many people probably saw that when Donald Trump was infected, they gave him an antibody cocktail called Regeneron. And, he seemed to think it worked well. Eli Lilly has also produced a similar antibody cocktail. So the federal government has actually bought, and they have ready, doses of all of these things. And as soon as either one of them or both get emergency use authorization, they're going to send it most likely, I talked to Secretary Azar, most likely through the states. And so if the state of Florida is getting that, we're ready for it. We're going to send that long-term care facilities and hospitals. If you have an outbreak in a nursing home, you have it. HHS thinks you can give the antibody cocktail to any resident who wants it, who may not have been infected, maybe even as a prophylactic. So I think these therapeutics have been really underrated. We hear a lot of talk about the vaccine. Hopefully we'll get a vaccine, but even successful, not every vaccine is going to be 100% successful. And so to have therapeutics where if someone does get infected, you can reduce the severity, that will take a chunk, hopefully, out of mortality and let people recover better. So we're working really hard to make sure that gets out where it needs to go. And we also recognize that there's other health needs other than just simply dealing with coronavirus. Many people know that a lot of folks have been scared to go in and seek medical attention. ED visits for heart and stroke dropped dramatically in March. They still haven't fully recovered. Obviously, heart attacks and strokes are still happening, so we want people to feel comfortable to go in and to get that tended to, because those are really, really significant health problems that if they're allowed to build, you're going to have way worse outcomes as a result. We've also seen a big decline across the country, but including here in Florida, in cancer screenings. We have a 33% decline in adult cancer screenings and a 44% decline in child cancer screenings per the folks who are on Medicaid in Florida, which we have easy access to that data. But I think you're going to see some similar for the broader public. I know HHS and CDC have looked at it for the nation as a whole. You've seen the decline. And so if you think you have millions and millions of people nationwide who've not gone in to get screenings for cancer, they don't pick up some of these in certain situations, that is going to really lead to some significant health problems down the road. So we want people to go in and get their cancer screenings. We're going to be working, and also immunizations for children, down 18% in the Medicaid program year over year. Again, that's going to be something that is going to be very, very problematic. And so we're going to be looking to do more messaging along the lines of don't let coronavirus detract from you getting the type of health care that you need. And then finally, in terms of health, is mental health. This has really caused a lot of problems in terms of mental health. We know CDC has said up to 25% of young adults have contemplated suicide in recent months. That is a major, major red flag. I have identified some additional funding from the CARES Act. So we're going to have an announcement on that, hopefully very soon, about ways that we can continue to fortify mental health efforts in the state of Florida, because I think it's really, really important. And I think this is a kind of a broad-based crisis like we've really never seen before. But again, it's something that isn't going away. Also, I think that plays into it is the economy. We've worked hard to allow businesses to rehire people. I think we've regained almost 650,000 jobs. Of course, we lost a lot, particularly in leisure and hospitality. Leisure and hospitality have grown the most because they were starting from the lowest depths, and we want to continue to see them grow. But we've also seen increase in retail, healthcare, and other types of assistance. And some of the areas that have been flat, like construction, have been flat because they've been going at it the whole time. I mean, we've had really, really good signals in terms of home building and home sales. The prices have increased 9.1% from April to August, just in the last few months. That's a $25,000 on average increase in the prices of homes. So people want to be in Florida, they're moving, and I know the home builders are doing really, really well, so we want to continue to do that. And then finally, some of the COVID indicators. We look at the emergency department visits for COVID-like illnesses. That's been very, very stable at much lower levels than what we saw in June and July, and so we continue to keep an eye on that. The number of COVID-positive patients that are hospitalized and being treated for COVID. Yesterday's numbers were an all-time low for us, ticked up a little bit back today, but we've basically been in that kind of 2,000 patient range now for several weeks. Probably aren't going to go too far below that, just because with an endemic virus, you're still going to have occasional infections or cases, just like we do in seasons with other types of things. So we look at that. Yesterday, the admissions to hospitals for COVID was one of the lowest single-day number of admissions since May, and currently 3.2% of our licensed hospital beds have a patient that's being treated for COVID, and 28% of all licensed beds are empty, including 28% of all ICU beds are empty, and obviously they have an ability to expand that as they want to. So those are things we're going to continue to monitor. But I do think being here is really important to me, just because of the opportunities that they're offering to these kids. Under any circumstances, I think this would be important, but particularly under these circumstances where they wanted to get the kids back into the classroom. They've worked really hard to do it. And just me taking the brief tour that I did, I can tell, these kids are in good stead here, and they're being cared for well, and the teachers are doing a great job. And so I want to thank what they're doing here, but also throughout the state. You know, as much as there were people that were fighting against opening schools, so many of our teachers really wanted to get back in to the classroom, and they really wanted to be there for their students, because that's why they got into this. They care about their students, and I think it's made a big difference. I think we're much better off today, than we were a couple months ago in terms of the health, safety, and well-being of our youth, and we want to continue to do that and go forward. And so Richard and I will be supporting the efforts, whether it's through the school districts, through the charters, or through our private scholarship kids. So I'm going to introduce Richard to say a few words, and then we'll hear from some of the folks affiliated with the school.
Thank you. First and foremost, this is a great opportunity to be here, because it's one of the special things that happen throughout our state. We have tremendous leaders, and when you watch what happened here, is you have somebody who's quasi in their retirement years. Hope he doesn't mind me saying that. But what does he do with his capital? What does he do with his time? And he's like, I'm going to invest selflessly in trying to provide a world-class education for every single student in downtown Jacksonville. And just whether it's his time, whether it's money, it's an amazing thing to see how quickly you've put together this, Ambassador Rood. But it's also just great to have folks like you in our community up and down the state who are willing to invest their own capital and time to give kids this great education. And I will say, what they're doing here is amazing. People ask me all the time, what's the disruption? What's the new innovative thing that's going to happen in education? And what we're seeing so clearly across this country is the disruption and the innovation in education is actually going back to those fundamentals. And when we just went through a classroom, and you have kids in kindergarten and first grade, and the teachers working through with them, when you have a word like tape and you have a softy and a consonant separating the vowel, what does the vowel say? And they all are memorizing these rules that the vowel says its name, so it's a long A. When you give that fundamental basis to kids, by the time they get to third grade, which is what we're teaching them to learn how to read by third grade, and then after that, they're reading to learn. But if we lose them in third grade, we pretty much lose them for all time. And so having that disruption be the fundamentals is something special. Our Teacher of the Year, we just awarded sixth grade math teacher, a predominantly free and reduced lunch minority population. And she took these kids who were getting 1s and 2s on the FSA in math, and in 1 year flipped them and got them all 3 or better, which is basically grade level or better. And people went to her and they were asking her, what was the disruption? What was the innovation that you did that transformed these kids' lives that fast? And she said, again, for 10 minutes at the beginning of every school day, because she realized they lacked that solid basis of fundamentals. And if you don't have those fundamentals in your automaticity, imagine Michael Jordan being a good basketball player. Every time he dribbled up the court, he had to say, okay, now I got to push the ball down, I got to push the ball down. If it's not automatic, same with learning, you can't go on to those next great levels of either sports or education. And so for the first 10 minutes of every day, she taught them their math facts. She created a game, she created rewards, but she had to get them to their math facts, which should have been there by the time they get there. But that's the disruption. That is the innovation in education. I always say the PISA is the international, they take 60-plus countries, and they say, where does America stand against these countries? We're like 24th, 28th, and 36th in math, science, and English. And people say, well, what does America do well? You know, those numbers aren't so great. And we score, generally speaking, we have the prettiest buildings, but you can always teach Play-Doh under a tree. You don't need a fancy building. And we have more tech than any other those countries in the whole world. We have tech everywhere. You know, blackboards that speak to us, iPads everywhere. But what matters, what educates those kids, is what you guys are doing, and that is getting to those fundamentals, getting to that automaticity in their minds. And when you do that, they're transformed for life. And so for what you guys have started and what you guys are doing, we're greatly appreciative. As far as the school reopening, the governor will not say it, but I will tell you, there's 50 governors in this great country. Only one governor went through all the forensics, all the analysis. I always tell people all the time, we were and we are not the guinea pigs. We are the smart ones who looked at what was going around the world. The governor, whether it was Asia, Scandinavia, Europe, we looked at all that data, and what became very, very clear to the governor early on, to the point that he called us in July, is we've got to open up schools. And even to this day, we have, of the top 10 urban districts in the country, Florida has 5 of them. Those 5 urban districts are fully open, fully face-to-face, teaching kids the great education that you can only get with a teacher standing in front of those children and those kids interacting with each other. All 5 of the top 10 that Florida has are open. The other 4 to this day are still not open, and 1 is only partially open. And to the governor's point, I like to quote the Royal Academy of Pediatrics in London, but to the governor's point, and this is something that he saw early on, and that is, let's stop this discussion, is it safe because of COVID, and ignore the discussion, is it safe not to send them back because of COVID? Which one is more to the point, to their health and emotional and social well-being, which one's more dangerous? And it's overwhelmingly clear that not having these kids interacting in schools is just overwhelmingly more, and it's an absolute risk. It's there. COVID, when it comes to these school children, is virtually de minimis or no risk, and we're seeing that from the reopening. But the Academy said that what we're doing is we are permanently scarring the hopes and dreams of a generation of children. And what's not happening in Florida is the permanent scarring of a generation of children, because the governor has opened up schools, and now we have the USA Today, the Atlantic. You can't pick up an article, a magazine, or a scientific study with, quote unquote, all eyes on Florida, and see that what we have done is absolutely special, it is great, and the kids are getting that world-class education they deserve, and the best mode that they possibly can. And honestly, Governor, it's hats off to you. It would not happen, because it has not happened in other states, what we're seeing here in Florida. So as far as the reopening goes, I'll say it. It has been an absolute overwhelming success to date. We're still vigilant every day. We're still making sure that we're looking at that data and making good decisions, but the children in Florida are getting what they deserve, and that is a world-class education available to them, and it's up to their choosing. And so with that, I do want to introduce the head of school here, and have him talk a little bit about just that innovative, disruptive model that they're doing here, and how they've got the kids back in the classroom and face-to-face learning, and doing a great job. So with that, please welcome Dr. David Withen.
Thank you. I'll be very brief, and I just want to say that it's an honor to have Governor DeSantis here, to have Commissioner Corcoran here, and of course Ambassador Root. It's always an honor to have you in the building, sir. And this is important, what we're talking about and what we're doing here, but the most important thing that's happening in this building is happening actually beyond the walls over here, because it's happening in the classrooms. And we had an opportunity to walk through and take a look at some of those things, just a few samples of them. We were looking at a phonics lesson in a first grade classroom. We were talking to some first graders who were finishing their lunch and getting ready for their own phonics lesson. We had the opportunity to stop in on a Latin lesson in 6th grade a little bit earlier. Those are the important things, and it's an honor, of course, to host some very special guests in Jacksonville Classical Academy today. But beyond that, it's an honor every single day to be in the classroom with some absolutely amazing teachers. Kindergarten teachers like Miss Hattie Anthony, who is a master of teaching those phonics so that our kindergarten students can go on to be great readers by the time that they get into 3rd grade, so that they can do things like pick up The Secret Garden in 5th grade and read that with Mr. Barker, who is one of our really amazing 5th grade teachers here at Jacksonville Classical Academy. And it's important that they have the opportunity to teach students in the least restrictive environment possible and to teach them in person. There's nothing that can replicate the relationship between students and teachers in a classroom or, as you pointed out, sir, under a tree. And we do read Plato here. Our 6th graders are learning about Plato right now. We haven't given that up. And in 9th grade, they'll learn about him again. And sometimes we go out and we do it under a tree. Mr. Barker has taken them out to read The Secret Garden in our garden in the backyard. But the important part is that we're doing it together, right? We're not doing it via video screen. We're not doing it with plexiglass between us. We're not doing it 6 feet away from each other, but that we are doing it in a way that is both reasonable and safe and meets the needs of all of our students. And so I want to give Mr. Barker and Mr. Anthony just a brief opportunity to talk about the things that they're doing in their classrooms and why it's important that we have that opportunity for teachers to do what teachers do best. So, Mr. Barker, please.
Thank you. I'm honored to be with men and women like you and get to celebrate education. I'm not an expert on policy or health, and so I can't really comment on any of those things, but I knew that if students were going to be coming into our building, that it was my job to make sure that they were safe and felt confident to learn and felt loved. I know growing up, I learned better when I knew that a teacher cared about me. And so I've learned that building relationships with students is the best way to build a rhythm of learning with them. Just this morning, every now and then we do something called a Socratic dialogue, which is an opportunity for our students to learn discourse, greatly needed in 2020 in our time. And so even our 5th graders are learning how to engage in discourse with each other. And just this morning, we had some Socratic dialogue that was focused on a picture of the bridge in Selma, Alabama, that the late Congressman John Lewis walked and has written and spoken about so many times. And one of the things that we were talking about was his quote, which I'll paraphrase. Basically, he said that they spilled a little bit of blood on that bridge. This is his quote. They spilled a little bit of blood on that bridge, but that there's still a long way to go. That we haven't gotten there. There's still a journey to travel or a distance to go. And I love teaching because I think that education is the means of taking that journey. And so my 5th graders are going to be the ones carrying the torch someday when it comes to engaging in the things that are right and good, true and beautiful, which is something we try to emphasize here at Jacksonville Classical. And I love the fact that I can teach challenging content while also pointing our students to virtues. And it's a challenging time, 2020, through the things with pandemic and some of the social issues that have been going on in our world and our nation. And our students have a lot of questions. And so we have a great opportunity to say, hey, I'm not going to tell you exactly how everything should be or is, but I can point you to good virtues, and we can learn how to engage in society with perseverance and courage and honesty. And those type of great interpersonal virtues. So that's what we're doing. That's what we're running after here, and I'm just honored to be part of it. So thank you.
Hi, I'm Miss Anthony, and again, I am very honored to be here, honored to be in your presence, and I'm very thankful to have my kindergarten scholars in our classroom. I have had that opportunity to teach online through Zoom and all those other great technology devices. And there's nothing like being in the classroom and actually connecting with the student and looking them in the eye and enjoying their responses. So that's what we're doing. We're doing a lot of great, innovative activities, learning so many different things, literacy, math, science, geography, history. It is wonderful. We were just talking about the different types of clouds, and we were able to actively create the clouds by moving around with our bodies. We're using our senses to actually have those students understand many different concepts. So it's just wonderful to be here, and I'm very excited about what we're doing, and I love to see student growth, so I can't wait to see what they're going to do at the end of the year and how far they're going to grow. I know they are going to grow, and we were just talking about perseverance. Everyone is not going to move at the same time, but we have to be patient, but we will get there, and they all understand that, and I'm thankful and glad that we were able to be here. Thank you.
Thank you.
Well, thanks again to the teachers for all the hard work that you're doing. We really, really appreciate it. We've obviously appreciated it from the beginning. I mean, the biggest thing we did in the last legislative session was take Florida from the bottom half of states for average minimum salary for teachers and bring us in, we are number 5 now, bring us top 5. And so it was something that was very, very important to us to not only recognize that, but to make sure that we're continuing to attract qualified and quality folks who really care about their students. But I could tell you, just having gone through this, to see so many of you step up and really be there for kids who've been in need. It's been a very difficult time for our youth, and seems like they were not always on the forefront of a lot of people's mind. I think that's regretful, but I think we now know we need to have these kids in school, need to have them enriched. And then finally, I'll just say, I know we're in a different part of the state, but we do have a Florida team playing in the World Series tonight. So I just want to wish the Tampa Bay Rays the best of luck. You know, if they're able to win that, then I think Tampa Bay is title town USA, because you got to bet on Tom Brady making it to the Super Bowl. I would never bet against Brady. So it could be a very exciting few months for the folks on the. What's that? That's what I'm saying. They won the Stanley Cup, and then if they win the World Series, that's enough for title town, I think. And then you have a chance to have a home team play in the Super Bowl, which would be unprecedented. But I think it's been pretty exciting. So best of luck to them. I know it's been a little bit different type of season, but if you hoist the trophy, you hoist the trophy, and it counts just the same. Any questions? Yes. Why did they close?
Because I believe in one school there was over 30 cases in students, and then another there was, I believe, over 11 cases. And for Duval County schools, there's a 20%, I believe, threshold where if 20% of the students could be affected, the school will be closed and they will be moved virtually.
Yeah, I'm not sure of those instances. I mean, I think what we've tried to say is, closing the school is not the best option. If you have some students who have positive tests, obviously you can isolate them, but that really is a better model than to just throw in the towel, because you're going to have a lot of students that need that instruction that are just going to be stuck at home for 2 weeks. Now, I don't know what happened in those instances, so I don't want to speak directly, but I know we've also had instances in which you've had teachers have some outbreaks in like a faculty lounge, and then they've had trouble bringing in some of the substitutes like they needed to. So that's happened occasionally as well, and that obviously presents, I think, a different issue. But one of the things that we've looked at, both Commissioner Corcoran and myself, is you should not be quarantining healthy students. We have people that get letters, parents get letters saying, oh, your son or daughter was exposed, they have to quarantine for 2 weeks. No way to appeal that, no way to do anything. And that really is not, I think, the way you want to go. And so if someone's symptomatic, by all means, isolate and have them stay home till they recover. But somebody that had just a glancing exposure in a hallway or something, to then say they're out for 2 weeks when they're perfectly healthy is not, I think, the way to go. It's interesting, if you look, before March of 2020, there were some kind of tried and true pandemic guidelines that got thrown on their head, and then we kind of went in. This has been a very big political thing now. But you go to like WHO 2019 website or pandemic guidelines, they would say you do not quarantine healthy people who've been exposed, that's not something good for the general public, much less for school kids. School kids, it's obviously even more problematic because, with this disease, you're not seeing them be the main vectors. It's usually the adults who are infecting them. So I just think that the more surgical approach, the better. And I think that we found in the areas where there have been exposures and isolation of healthy, very few have tested positive, right?
Correct.
Yeah, so very few. So you end up in a situation where you're taking out a student from academics, activities, all these things, when they're perfectly healthy. Now, we have sent these Buy Next Now tests to the school districts. What we've recommended is if you have someone that's symptomatic, obviously you can test them. We're going to work on saying, you know what, if you're going to take a healthy student and send them home, unless they test positive, why would you want to force them out of school? So I think we're going to work on, a way that can be a little bit more surgical. But I think it's been a problem. I've talked to different parents who've been frustrated by it, and I know people are trying to do the right thing, but we also have to look at the data. We have to look at kind of what's going on, and then weigh taking a perfectly healthy student and putting them home for 2 weeks, what that does versus you can continue to monitor them. Obviously, if they develop a symptom, then you can take appropriate action. Yes, ma'am.
I have the same question as her, but I believe there's a third school that's sending children home because of COVID. Is there any instance that the state would decide to close schools?
Well, one, it's not our decision to close schools, but no, we are not going to recommend school closures. It's not proven to be something that has been effective. I think we look back in March, there was a lot that people didn't know. We did know that the kids were at much less risk. And if you look now, the data is clear. A school kid is about 1,000 times less at risk than somebody who's in, say, 75 in a long-term care facility. So we know that. We didn't know the role that they would play in community transmission. Was it like influenza, where this was kind of the germ factory where you would have the disease spread because of schools? And that's just not what's going on, anywhere in the world. And so I think the closures, we got to move beyond that. The cost of a closure is so devastating, and that you don't want to do that. So, and again, I don't know, like on these individual schools, how they're doing it. Yeah, I don't know the facts on all that, but I can say broadly speaking, parents are going to be able to send their kid to in-person into the future. We just have to do it. It's something that's very important. Anybody else? Okay, thanks everybody. Take care.